Today we're going to go over the residency and training of pathologists in the U.S., an overview. This was part of a discussion on how to build a successful pathology training program in Egypt. American Board Certified Doctors for Egypt are not responsible for the contents of this lecture. So to understand, generally speaking, how everything works in the U.S., you have to kind of get an understanding of the whole overview. So you have medical school, then you have residency, and then you have the American Board of Pathology exam, and then you have the future, right? So let's go back and talk about just medical school. Medical school for the US actually has two parts. There's pre-med and then there's medical school. So pre-med can actually be almost anything, but the majority require biology, chemistry, biochemistry, organic chemistry, and physics. And then there's a bunch of other things that are recommended, such as anatomy, writing, social sciences, humanity, diversity, and ethics. Different colleges may have different and more extensive requests for pre-med. Once students are done with pre-med, they have to study an exam called the MCAT. The MCAT is the Medical College Admission Test. This is a multiple choice examination. It has biology, biochemistry, psychosocial, and so on. And this is a test that they prepare for, and they prepare for. Once they pass it, depending on the score, they can be accepted into medical school. So let's talk about medical school. What is medical school in the US? Medical school in the US basically looks like this. It's 4 years. The first year consists of histology. So basically, it's all together. It's combined. So physiology, histology, immunology are all together in different systems. The first year has a lot of basics of physiology, histology, immunology, and so on, as well as pharmacology. While the second year, they start to take different groups. So endocrinology, renal, pulmonary, cardiovascular, pediatrics, and so on. Each one of these have incorporated the different aspects of the physiology, histology, immunology, and so on. And they also begin to do medical exposure to patients, which includes what they call clerkships, sometimes they call them internships, and then electives, and so on. I think the main thing here is that it's all mixed together. So for example, if they have the GI system, they'll take the physiology, histology, immunology, genetics, and so on, and pharmacology of the GI system. You see what I mean? As opposed to each one by itself. Let's go to year one in more detail. Systemic disease, pathophysiology, and they also have to take something called the United States Licensing Examination, Step 1, okay? And this is from their website, the USMLE, where they would have pictures like of pathology, and then they would have a diagnostic and some kind of clinical background for that, okay? Let's look at year 3 and 4. The electives, they have to take pathology and radiology combined rotations, and they take the exams, the CK, step 2, clinical knowledge exam, which is also a test of clinical skills. Step 3 is more of an interactive exam where they actually have a patient, and then you have to manage that patient, and hopefully that patient will survive according to your management and not die. So next, what does it mean for MD, PhD? There are some places where they do MD, PhD programs. MD here stands for medical degree, not medical doctorate. It's called medical degree. Some places have a PhD, which also includes a thesis. And in those cases, those students would take a mixture between the PhD program and the medical school program in order to graduate in about 8 years. So next in line, let's talk about, so this patient, here's a typical medical school timeline. Undergrad, 4 years, medical school, 4 years, residency, 2 years, fellowship, 2 years, USMLEs, electives, and so on. Let's talk about residency. Residency has a number of different aspects. The first part is the application system. To apply to residency, you have to join something called the electronic application system, which consists of USMLEs, letters of recommendation, personal statements, research, public work, and these are all sent into these programs who review it, and each program has its own kind of criteria. So if you look at all these, you can actually find the statistics of the number of positions that were filled, the number of positions that weren't filled for each different specialty, and so on and so forth. They also usually need transcriptions from your medical school, proof of USMLEs, and so on. Residency training consists of either, in pathology, is usually AP-CP. Some people do AP only, some people do CP only. There's also combined programs, AP Neuropath, AP Forensics, as well as Physician Scientist Training Pathway, which has 1 year of research. AP-CP is usually 48 months of the program, 18 months of each, AP and CP. 12 months are usually flexible. This is an example of what it could be. So like a first-year residency, a resident would have GI, for example, chemistry, GI, GYN, head and neck, cytology, depending. This is a university hospital where it's very much subspecialized. So renal is taken at a different time than chemistry, which is taken at a different time as GYN, peds, everything is very different from each other. Other places or community hospitals, you'd have it combined, like just general sign-out, which would include everything. So let's look at AP. So AP consists of autopsy, breast, cytology, derm path, bone, thoracic, GYN, and the rest of all of these. This is a very classic, what's it called? Overhead dissection, gross dissection place, where you have a place to dissect, a place to the lighting, the water source, and the overhead system to remove the smells. Learning how to dissect is an important part of there's books for that sort of pathology where they show you how to get the exact right amount of right sections that you need. Obviously, these tissues are later converted into slides, right? And let's see, there's also software and systems that help to organize different things. Let's see, the schedule. A lot of places do a 3-day schedule. So the first day grossing, second day frozen section, second day gross and fixed cases, Thursday sign up. There's also a 5-day schedule. Day 1, all day grossing. Day 2, all day sign up. Day 2, 3 sign out and grossing. Day 4, sign out and grossing. Day 5, sign out and gross 1. So it really depends on where different places and how they organize their things. There's also didactics. It's important to have tumor boards, conferences, book funds, online access to journals and e-libraries. CP. Clinical pathology is basically chemistry, heme path, blood banking, flow cytometry, molecular, cytogenetics, toxicology, coagulation. Each one of these are rotations. The most important one I would say would be blood banking, because that's the one that you would consistently use in the future, unless you choose to go into, heme path or forensics. Heme path, you probably need to know a lot of flow cytometry. Microbiology are commonly, a lot of PhD students like to go into microbiology as well. So that is that. After you're done with fellowship residency, there's usually a fellowship. Fellowships, or all of these, are considered fellowships. And there's some of them have certificates, some of them do not. These ones have certificates. So these ones have a board exam, and after that, a certificate. What is the ACGME? The ACGME is the Accreditation Council for Graduate Medical Education. ACGME is actually a private organization. It came out in 1981 out of consensus that there needed to be an independent agent that can review. This independent agent consists of nominated of at least 4 people from each of the founding organizations. Okay, so the AMA, the American Board of Specialties, so on and so forth. They also have 2 residents, 3 representatives of the public, a chair, directors, non-voting representatives. They have a council of review committees, chairs, and council of review residents. What's RRC? Resident Review Committee. The Resident Review Committee evaluates the quality of residency training. These members are appointed by the ACGME, but there are nominations. And they also include current residents. If you go to their website, you can find out who these are. You could also see documents, resources, program requirements, and review the committee members. How does the residency program become accredited? Well, there's on-site programs, 1 day. So they visit the programs, and the accreditation is given either 2 to 5 years out of 10 years. Narrative reports are done, lengthy interviews, supporting documents. The residency review committee meets about 3 times a year and reviews the site reports. And also they're voted. So they're either given accreditation, full accreditation, warnings, probationary, and or accreditation withdrawn. Evaluations. So they evaluate duty hours, the faculty, educational content, resource, patient safety. All of these, are these available or not? Supervision and training. Is there enough time? Is there enough educational content? Is there enough resources? Again, these are all in more detail. These are all available on their website. They're given numbers. Yes, no, and sometimes like 1 or 2, depending on where they are, the program is. They're given a results survey analysis, including all of these together. There's also something called the RISE exam. Ooh, well, it has a whole bunch of different things that you can use. This is provided by the ASCP. It's a service exam, which is optional, but it helps programs show where their residents are when it comes to the level of their training. Data log system. The data log system is basically where both the programs and the residents can put in all their information, whether it's the number of cases that they've seen, whether it's any awards they've received, whether it's duty hours that they have provided, and so on. There's something called Milestones, or 6 core competencies. This was a project that was done between ACGME and the American Board of Pathology. They made 6 core competencies, which include patient care, medical knowledge, practice-based learning and improvement, interpersonal communication skills, professionalism, and system-based practices. Milestones. Okay, the residents are given level 1, 2, 3, 4, or 5. Level 5 is the highest. The resident has advanced beyond performing their targets and so on. This is just an example. These are all available again on the website. Procedure, autopsy. Has the resident achieved level 5? If the resident is at level 5, the resident has proficient, and therefore gets a level 5. And that is across the board for different areas, including this is lab management. Level 5, the resident participates in compliance with assessments and other lab management things. There are other accreditation agencies. Okay, so there's CAP, College of American Pathologists, JCO, CLIA, federal agencies, and then Medicare and Medicaid. All of these are involved in maintaining the standard of the labs. Some things like how long do the program have to hold on to cell blocks? Who can be the one to direct the lab? How are the biohazards being disposed of? What are the working limits? All of these have, according to each one of these, and the better labs will be CAP accredited, JCO accredited, and of course they have to comply with CLIA in order to receive Medicare and Medicaid funding. So there's also federal agents which are responsible for things like biohazards with fire and transport of biohazardous materials and so on. So there's a number of different organizations, the main one obviously being ACGME, but other ones as well. What is the American Board of Pathology exam? So basically, the American Board of Pathology has a cooperation of a number of different societies. You can go to their website to get some more information. The history of it started in June 1935, and the idea was that they wanted a way to assess the residents. The exam outline, you have CPAP and examples. You can actually go to their website and see that yourself, all the different sites, and it also shows you the breakdown of how much percentage of each type of each part of CP is on there. AP is a similar kind of idea. It will show you the different areas, percentages. So cytopathology, for example, is 28% of the practical core component. There's a written, practical, and virtual micro. This was prepared in 2019, so I'm not really sure if anything's changed since then. Probably not. Examples, you can go to digitalscope.org, you can go to abpath.org, and we can show you how each one of these, more and more these exams are moving away from labs to with regards to subspecialty training. Obviously, you have all kinds of different certificates. Each one, you can also go and see that format of their exam. Maintenance of certification used to be Part 3, which is every 10 years the exam. This has been replaced by SurgiLink, which is an ongoing process. But the American boards are using parts. By for 3, they've now replaced that with an ongoing maintenance of certification exam. What is the future? There's lots of future. Digital pathology is taking on. There's telepathology, some companies which now provide it. Oops, looks like I didn't put that part in, or it didn't load. So telepathology, that's an area that's obviously being in. Precision medicine, in vivo microscopy, what else? And informatics. It's an interesting field, artificial intelligence, which will not quite take our jobs yet, but you never know. Genetics, a lot of things are being replaced from pathology into molecular testing. These are digital scanners, massive digital scanners that can scan, many slides. What else? You can read more about those. In vivo microscopy is a very less common known specialty, but it's like real time. So while the patient's on the table, the pathologist can actually use a microscope attached to the endoscopy suite, and that's also not that common. And then, of course, informatics is, let's see if there's anything here for informatics. No, I didn't put anything there. All right, so informatics as well is being incorporated, and this is actually a subspecialty now. You can actually do a fellowship in bioinformatics. And that's all about incorporating the data mining into the electronic and so on. And so this is an overview. I hope that has been helpful for you in some ways. Please do visit our website and learn more about what we do. And I believe that's the end of this lecture. Thank you very much for attending.